Hi there. Hi, this is Belinda Alio, and I am coming live to you from my mother's spare bedroom, Grandma Cookie. Today I'm taking care of my mom, but I wanted to spend some time with everyone and talk about the Medicare annual enrollment period. Again, my name is Belinda Alio. I'm a senior healthcare specialist, health plan specialist with Medicare Choices. I would like to thank Kim Russell and Valerie McBain for having me on the live stream tonight, and I hope that I can answer any questions that people might have about the Medicare annual enrollment period. So I guess we'll get started. First of all, I'd like to say that if you haven't joined us before, Navigate Home is a group of professionals providing services for seniors in the Rochester and surrounding areas. Tonight's topic, again, is the annual enrollment for Medicare, commonly called AEP. Excuse me. AEP is a time for people on Medicare to review the plans that they have, whether they have original Medicare with a Medicare supplement, a standalone prescription drug plan, perhaps an Advantage plan, which includes prescription drugs, or an Advantage plan that does not have prescription drugs. So once a year, we get the opportunity to review those plans and decide whether they're meeting our health needs, number one, and number two, our financial needs. So during this time, I commonly meet with people and educate them about things that are new as far as Medicare. And I know a lot of people are very leery this year because of the COVID pandemic, but I want to assure you that agents are meeting with people telephonically, also via email, and also using Zoom. So getting together and reviewing your benefits can happen this year, no problem at all. I commonly talk to people over the telephone. Prior to our telephone conversation, I email them information about new plans, review their plans with them, and then we discuss it over the telephone. And then they can make the decision themselves about what's most important for them. So I know a lot of you have probably been bombarded by the television the last few weeks during AEP about all the great things that are happening with some of the Medicare plans. A lot of the Medicare plans this year have really stepped up additional benefits for seniors. So they're providing 1 or 2 dental cleanings per year. They're providing over-the-counter products that people can order via telephone or mail order. They can order on their computer and have these items sent to their home. And what a wonderful time to have that benefit, to be able to get your over-the-counter products from the pharmacy delivered to your doorstep. I think that having those options are very good things for our seniors. Also, a lot of the Medicare Advantage plans provide hearing aids. Some provide glasses, frames and lenses. Every year there's a benefit, routine hearing exams, routine vision exams. Also the gym membership, which some people are not using right now, but a lot of them have the opportunity to be able to access classes over the internet, exercise classes, that you can do right at home. So those are wonderful things for the situation that we're in right now with the pandemic. Also, what else can I tell you about the plans? I think I covered that. Some of the plans this year are coming up with a healthy food card benefit, and that's helping with people that are having food insecurity and is a great benefit to people on Medicare and sometimes for people on Medicare and Medicaid, being able to get some extra dollars toward healthy foods at the grocery store. What else did I want to talk about tonight? One of the biggest things that people call me about is they'll say, Belinda, my insurance costs for Medicare are getting out of hand as they get older and older. So an example of that is 10 years ago, a person would get a Medicare supplement and a standalone prescription drug card. And year after year, everything keeps going up in price. And that's why it's so important to review your health care with a professional that can, take a list of your prescriptions, check it in the formulary for a couple different plans, and help you figure out how to lower your costs for the year. Lots of things have changed over the last few years. There's some very affordable prescription drug plans out there, and we are happy to help people find a way to lower their costs each month. Medicare supplement is a little harder to change, especially if you have any pre-existing health issues. So those are things we can also talk about on the phone. Medicare Advantage plans can be changed every year. Those do not take into account any pre-existing conditions. So that's the beautiful thing about a Medicare Advantage. We can change from year to year. So for an example, I had a man on one plan last year. This year, he came to me and said, Belinda, I really need to have some denture work, some work done on my partials. Do you have any plans that have a good benefit? And I said, yes, there is. A new one came out this year, and they're providing a very good benefit, and it does cover dentures and partials, and the monthly premium is very affordable. So you can switch Advantage plans every year if you want to. Not that everybody wants to do that, but if a plan has a benefit that you're seeking, you should contact someone like myself or the other agents that work in our business, in our office, Medicare Choices, and we can help you find what you might be looking for. And at the end of this live video today, I will post my phone number and email and how to get in touch with us. Some people have asked me, when I go on Medicare, can I still contribute to a health savings account, to an HSA? Well, the answer to that question is no. Once you take your Medicare, you no longer have the opportunity to put money into a health savings account. You can, however, spend your health savings account toward things that are extra that maybe your plan doesn't cover. For instance, if your Advantage plan just covers dental cleanings, you could use your HSA for additional work that you might need to be done, crowns or root canals or things like that. So health savings account, that is something you can use when you're on Medicare, but you cannot contribute to one once you do elect to take your Medicare. Let's see, what else can I talk to you about tonight? Oh, well, we did talk about the gym membership, and we're hoping that we'll all be able to get back to that. Also, we know that this can always become very confusing for people to try to compare themselves, to go online to Medicare.gov and try to figure out what plans can help you lower costs or increase your health benefits. So it's always a good idea to contact a professional who specializes in Medicare and Medicaid plans for people. And that's exactly what we do at Medicare Choices. And if anybody has any questions for me, please go ahead and let me know. I'll be very happy to answer them. Kim, I just wanted to say thank you for your thank you about giving the valuable information. Here's a question. How do I know if I have the right prescription coverage? Your agent can get your list of prescriptions, look them up in the drug formulary for the different plans, and report back to you which tiers those drugs fit into. So on a prescription drug plan, you have 5 tiers. You have tier 1, your preferred generics, tier 2, your regular generics, tier 3, brand name drugs, tier 4, specialty drugs. Some tier 5s are also specialty drugs. And starting at 1 is your lowest copay. So once you have your prescription drug plan in place, your agent can look at the different tiers of your drugs and figure out which plan would be best for you. If you're a person who only has tier 1 and 2 drugs, which are preferred generics and generics, you do not need an overly expensive drug plan. You will likely never have to pay a drug deductible if you stick with tier 1 and 2 drugs. It's when you go into the tier 4, 3, 4, and 5 drugs. Most of the drug plans have a deductible. It's a standard deductible. Typically next year it will be $445. So the beneficiary who has that drug plan would have to pay the $445 before the drug plan kicked in their part, and you would pay a copay. There are some drug cards out there that have no deductibles. So if you are prescribed a tier 3, 4, or 5 drug, you would not pay a deductible. However, you will usually pay quite a high premium per month. So again, it's important to have an agent review your drugs and come up with the best plan for your finances. I hope that was clear for you. Are there any other questions that people have about their Medicare annual enrollment period? If not, I just want to reiterate that, again, you can reach out to us. We do not have to meet face-to-face this year. We can definitely help you over the telephone, via email, or even a Zoom meeting. And that way, you don't feel like you have to go another year with a plan that you possibly is not meeting your needs. So again, my name is Belinda Alio. I will post my phone number and email address at the end of this video live. And I want to thank everybody for attending.